Awesome. Well, we're here with Ali Rohan, uh, dentist from the LA area. His practice clinic, Dental Plus, joining us for a conversation around overall dentistry innovation and where AI is headed in that vertical. Dr. Ali, thank you so much for joining the conversation. Maybe for those joining for the first time, give us a little bit of background, tell us a little bit about yourself, and yeah, we'll get going from there.
So I am a general dentist, but my focus is on implants or implantology.
Mhm.
I was studying in Arizona for a few years, and once I finished up my studies in 2022, I moved to California or Los Angeles specifically, and I've been working and practicing here ever since.
Amazing. Um, how many years have you been in the industry, more or less?
So I've been doing dentistry for about 5 or 6 years, but I've been specifically here in LA for 4 years.
Okay. How I usually come from a background where we are a lot everything about stories, right? And I know that everybody in a way has their story. How did you end up on this path? How did it start?
Yeah, so I always wanted to go into medicine, but when I was comparing medicine to dentistry, I just came to the conclusion that I can get more hands-on and more surgical with dentistry earlier on compared to medicine. So I chose this route because I feel like it fit my personality more, and here we are.
I see. For you, how was that process? Was this something that you discovered early in your life, or as you were exploring alternatives in the medical field, you kind of understood that this was the best path for you?
Well, I always had this kind of affection towards medicine and healthcare. Um,
Hmm.
but I over time I just realized that dentistry was a better fit for my personality compared to the other branches of healthcare. But even dentistry itself was quite a struggle for me in the beginning because it requires a lot of artistic and very detailed hand skills because you're just working in a very small area. And that's something that I had very little experience with before going to dental school. So initially, it was quite a struggle for me. But over time, with practice, I started to kind of drift more towards surgery rather than some of the more artistic, cosmetic side. I just felt like it was better fit for my personality and my talents.
Right. Well, those are definitely some of the things I hear from dentists, right? That they don't teach you, or they don't necessarily, tell you before you jump in. Um, so sometimes you have to muscle your way through. And another one that I hear a lot is, a lot of dentists enter the practice, and once they're in the practice, they don't realize that it's far more than just showing up to. A dentist work. There's a lot of other things that go with the field. Have you been you own your own practice right now, or you have anything in the management of your practice, of your clinic?
Yeah, it's a good point that you brought up that it's not just about the clinical side and there's just so many factors to it. Just like any other business, when you're an owner operator, um, there's just a lot going on. Obviously, the dentistry itself is difficult. There's a lot of technical aspects to it, but then you got to deal with the psychological aspect of the patients because a lot of patients are coming in, they're feeling scared, worried, anxious, and some of them are in a lot of pain. So you have to be able to manage the psychological aspect of it while also managing the business side of it. So that's why I think having a really strong office manager, which in my case I'm lucky enough to have, um, it makes your life 100 times easier. Otherwise, you're gonna be getting a lot of gray hairs over your career.
Yeah. Yeah, I think that's probably one of the biggest bottlenecks coming out of an extensive study curriculum. That most of the time you're very prepared to you know let's say enter into the practice itself, but the business side of it is something that takes a little bit of time to really grasp. Um, was this something that you understood early on, and kind of align with being able to source that out, or did you have to learn through the hard trials and turbulence? Let's just say.
I mean, a lot of things just in life and business, it's just going to be a matter of time and just
Hmm.
going through difficult times until you learn. So there's kind of no way around that, to be honest. Um, it, Nothing really prepares you for that unless you have a family member or a parent who already owned the business in that field. But certainly, I was kind of mentally prepared for the fact that a lot of dentists are business owners and owner operators, and I already entered the field with that mindset for sure.
Um, so there's a lot of nuance innovation that has happened in dentistry. I would say along in the past 10 years. Obviously you're kind of more in the forefront of a lot of this innovation from your experience, right? What is changing constantly, or what are the biggest changing, especially maybe in your specialty, right, which is the surgical part of dentistry? What are you seeing there that maybe even through your educational process you are learning now?
So I think just like in our lives, in me and you, or the global trend is that we want things quicker. We want it immediately. We want it today, here and now. And our patience has kind of decreased for everything. And that's just not limited to everyday things. It's becomes part of healthcare and dentistry as well. And that's why digital dentistry, 3D printing, and these kind of things has really emerged as pretty much a really almost basic thing now because most patients expect immediate results. And you can achieve that with digital dentistry and 3D printing. Whereas before, um, things took longer. And
Yeah.
we're just in a new age that everybody expects things quicker.
Yeah. I would say, I mean, you can probably attest to this, but what do you think has been the let's say how far, how quick have we shortened the gap, right, between being able to diagnose and deliver some of these needs within the field, like from a time that you consult somebody to the time that your turnaround in, let's say, delivering implants or things like that. How far, how quick have we shortened the gap?
The more technology you have in your office, the kind of you close that gap more. And one of the good examples that we have with our office and the type of dentistry I do specifically, which is implantology, is um, we're able to give patients a full arch of teeth or two arches of teeth in a single day. So a lot of patients, they come in with a lot of missing teeth, or they're coming in with all of their teeth missing, and we're able to do the surgery, do a digital scan, uh, have our technician um, do the virtual design of the teeth digitally as well, and then do a 3D printed design of those teeth in office, and then actually attach it to the implants that we place surgically. All of this happens in one day. It's a matter of hours,
Wow.
and then that gap is closed.
Wow. That is quite impressive. I mean, I still see and hear about cases, right, where it takes weeks to do. I guess people, not too many people have really adopted technology in your field. You can see the separation. So all these procedures you talk about are in a way common, right? Most people go to that. Not too many people have the habit of going to dentists, regularly. They go when they have something missing. But going from weeks to days, it's definitely quite a turnaround. Um, from procedures that you are seeing today, and let's say um, how innovation is going. Um, what else are you seeing, right, that is really impacting the dentistry, and let's say advancing, um, the dentist field overall? What nuances are you seeing in technology?
Definitely, things becoming digital started and kicked off this the idea of automation and AI. So in the past few years, we're definitely starting to see AI creep into dentistry. I think there's good parts, benefits, pros and cons to this for sure. There's no doubt about it. There's also the business side of dentistry that AI will be helping and already is. Personally, I think that in the business side of it, I like it more in terms of AI. The clinical side of it, I'm a little bit more hesitant, although I am definitely open to it kind of being a tool and rather than being overly dependent on it.
Right. Right, I agree. I think that we're still need to shorten that trust, right, with the technology, for us to really rely on it on the surgical, side of the practice. But definitely in the management, right, or uh, let's say in managing the funnels and intakes of clients and paperwork. Do you still see any gaps, right? Any bottlenecks that you say this is probably where AI should target or can be of more benefit?
So I'm happy you bring up paperwork because it's something that in our office where it's a very high concentration of insurance and
Yeah.
Medicaid patients, which involves a crazy amount of paperwork. Um, my staff, it's something that they least like to do is paperwork and dealing with these just repetitive tasks, which they just it becomes tiring for them. It involves no kind of mental stimulation for them. So in terms of that, I'm really hoping that AI can jump in and make their jobs easier.
Right. So there is that gap that needs to be bridged between, let's say, even insurance companies and the patient itself. You see a lot of opportunity there that definitely AI could be of service, or let's say of assistance.
Yeah, I think, like we said, patients are expecting things to go quicker and they want it more immediate right now. So, if AI is able to kind of make those timelines quicker for the patient and for our office as well, then it's better because we see a quicker turnaround and we can get to doing the dentistry instead of the paperwork.
Yeah. Dr. Ali, you mentioned earlier about some of the risks that or not risks, but let's say, uh, you know, the cons, right, about the technology. Where do you see these cons maybe that can surface or that we should be aware of, right?
So I see it both on the clinical and business side. In terms of the clinical, which I'm obviously much more familiar with, I can say that if you're a beginner dentist and you're overly dependent on AI, it will definitely be disadvantages to you. When you have more experience clinically, you develop this instinct, obviously, over the years, which just comes from experience, and there's no way around it. But once you have that instinct and experience, you can use AI more to your advantage in diagnosing, because I see AI diagnosing things that a computer doesn't understand. It just sees something and thinks that it should diagnose it, whereas it it's maybe just within the normal limits of anatomy and health. And on the business side of it, like I mentioned, I think it's going to be really good to do certain tasks that humans don't enjoy doing. But I really would like to avoid AI kind of coming and taking over some of the essential jobs that we do as humans, and kind of making it less personable. That's the one thing that I really want to avoid.
Right. Um, you know, it's been 5 years that you're in the practice. You had your process, right? Going to dental school and entering in these curriculums. How far is that gap between the technology available now to what they were teaching you in school? Have you seen any acceleration in that with, say, the new dentists that are coming in that are already prepared with this technology? Or is this still a process that a lot of dentists need to catch up during the field?
Well, the schools and the curriculum you mentioned, usually the schools, they're very up to date on technology just because they kind of have an unlimited budget, right?
Right.
They just spend on the most fanciest and the best toys possible. Whereas I think your typical office is probably not there. The gap definitely exists in your average office. Maybe your boutique office, some of the very high-end offices already close that gap, and they're very integrated with AI. But I think the majority of dental practices have not closed that gap yet in the AI world.
Hmm. Would you say it's habit what's causing maybe some resistance in the adoption? Is it just people are just used to it, or you see some maybe uh, let's say pushback, right, from some of the colleagues or people in your industry, or dentists in your industry?
Really, habits are hard to break.
Hmm.
I can't argue
Right.
with that. It would be the case for me as well. But habits will be broken once you see a ROI, and
Yeah.
if you're convinced that there's a return on your investment with AI, then you're just forced to break that habit, because you have to face reality and use it to
Right.
your advantage.
Would you say, since you are using innovative techniques in your clinic, um, I mean, is that been able to really catapult, the volume of patients that you take care of? Are people aware? Are these things uh, things that people are aware of when they already come into your clinic? They know the turnaround will be quicker.
That's a good point that you make, because I think this technology, the same day immediate teeth, is something that a lot of people that come in initially are not aware of.
Hmm.
However, when you do use it, and when that patient refers another patient to you, it's because they had a good experience. It's because they saw the wonders of the technology. And when our internal referral system has been, I think, like many other dentists would admit to, your biggest ROI.
Yeah.
It's hard to beat. And when they become familiar with this technology, they go tell their friends and family, and they come
Right.
to you after that.
Yeah. I just recently interviewed another dentist in your practice, and I asked him a question that was, related to what would you consider to be, the best AI tool. And he said, It's not for me to tell. It's really for your customers. They will determine what the best tool is." So oftentimes we don't see it we don't see the return of investment ourselves as we're using it, but in the practice, right, or in the work that we're doing, the clients will tell you, right, through their experience, what is the best technology. Um, Still, would you say that there are, procedures or, let's say, processes in your practice that you say um, you are welcoming technology to leverage that for you? Are there still gaps where you say, okay, this can be definitely an opportunity for AI to pick up?
Yeah, so I think that, like I said, our front staff, they're just constantly busy dealing with paperwork, answering phone calls, checking, verifying insurance. And a lot of times they're not able to respond to patients immediately. So I think if we introduce, we already have some mechanisms of automation, but if we introduce even more AI and custom AI, particularly in dentistry, where they can answer patients' phone calls and messages when our staff is not able to do so. That's a way to retain a customer that we may have lost.
Yeah, yeah, 100%. Um, Overall, what are those dentists that, if you had insight, what are those dentists that are not adopting AI? What are they getting wrong about the technology?
Well, honestly, I myself, I was opposed to AI for a while, and it's because that I was really against it, kind of coming in and taking away jobs from humans, and it's already happening. We can't argue about that.
Right.
But it's not about it, replacing a human. You got to, the way you got to think about it is it's going to help your staff and kind of be a supplement. And the same way that for me in the clinical side is going to be a tool rather than me being overly dependent on it. Something that I said earlier is that some people, if they become overly dependent on it, then that's going to be disadvantageous to them. So, on the business side as well, it needs to come and help your staff, not replace them.
Right. Yeah. Yeah, oftentimes I agree. I mean, we've dealt with that question a lot, and I think that some of the data that is coming out shows it. Right, we are definitely hearing over headlines. On more cuts. Meta's cutting employees. Oracle. Especially around the tech sector. But funny enough, I think that last month there was some new stats in regards to radiology, and maybe
Mm.
that can transfer into a lot of other medical sectors where they actually were hiring more radiologists and medical staff, right? Um, so ultimately, I believe that there's that opportunity where AI will be optimizing your skills, right? You're being let's say enhanced by AI rather than really in fear if you adopt it, right? AI will not replace you, but replace you with somebody that is using AI pretty much. Do you follow the same sentiment, or let's say you have a different take on it?
Yeah, I saw that statistic about the radiologist, and I thought it was interesting. And I think we'll probably saw a little bit of a dip, and then it went back up once people realized what AI is supposed to be used for, which is
Right.
just to help you as a tool rather than replace you. So, yeah, I agree with you. Definitely, we need to learn how to use it as a tool rather than just kind of throw it away.
Yeah. Awesome. Well, any overall sentiment? Let's give a projection of 5 years. Uh, Dr. Ali, where do you see AI, converging in the world, and then specifically in the sector? What is that world going to look like in your eyes, if you can forecast that?
Well, I think we just have to be optimistic, to be honest. But at the same time, you need to be cautious. Blind optimism is naive. You must kind of continue with the traditional values which you've had both in the clinical and business side of things, um, but learn to use AI to your advantage once you've established kind of the fundamentals. And it's the fundamentals, once they're established, AI can come and help and enhance those fundamentals. So that's where I think that things will really grow.
Any piece of advice you wish you would have maybe heard or learned before you enter this trade, uh, uh, that you can maybe share?
Well, success is not overnight. There's no way around it. You just have to go through the hard times. And once you develop that instinct and experience, which comes over time, then you're going to start to really enjoy yourself and just enjoy the profession more.
Amazing. Well, Dr. Ali, I really appreciate you joining the call. It was always, really a pleasure to connect with you. Thank you so much for giving us your time and sharing us insights around, your practice and how innovation is converging into and making, dentistry better. So I really appreciate you joining the call.
Been a pleasure, Alex. Thank you.
Awesome. Thank you.